One of the problems that people have with their teeth nowadays is decay issues. In the past, everybody went to the dentist and all we wanted to hear was, do I have any decay? Well, believe it or not, decay is still the leading disease that people in the world have today. Decay is number one. So what we've done in our practice to try to fight that is we don't want to just keep doing the things we did in the past and hope that they work. In other words, you come in and you get your teeth clean, we put some fluoride on your teeth and send you on your way. Well, for some people that works, but for many of the population that's not working for us. So we had to think outside the box and come up with different ways in order to take care of people's decay issues. We used to think if you have a tooth and you have plaque on your teeth and then you're put some kind of sugar substrate in your mouth, you're going to have a disease. Well, I have plaque on my teeth from time to time, and I eat candy, and I have teeth, but I haven't had a cavity since I was 20 years old. But we have people in our practice that have that issue a lot. And so when the patient comes in, if they're going to spend money to have their teeth restored, we want to do something more than just tell them to brush better, because that's not working for those people. And in fact, there are different reasons why people have decay issues. Number one, we used to think that enamel is enamel, but that's not actually true, and we've actually found nowadays that some people had a genetic predisposition to having decay due to a problem with their DNA. That's one situation. The other situation that we have nowadays is that we have a lot of people that are growing older, living longer, and we have root surface decay issues that we never had before. People are living longer, they're keeping their teeth longer, and now we have decay issues. Medication causes people to have dry mouth. People ask me, what medications? Name one. They all cause dry mouth. And with those people, if they put the wrong thing in their mouth, like soft drinks or mints on top of the dry mouth that they have, it's going to make things 10 times worse. Another thing that we have issues with for patients is patients that have drug problems. I mean, younger people. We have people that have bulimia as well. Those people have problems with decay. We also have problems with people who have esophageal reflux, one of the new terms out there, gastroesophageal reflux disorder. Those people have acids coming up from their mouth that increase your likelihood of having decay as well. So all of those different issues make it much more difficult for you to take care of your teeth and make sure you don't have problems. But nowadays, one of the things that we're able to do in our practice is we can swab your mouth to determine whether the bugs in your mouth are more inherent to you having decay as opposed to a normal biofilm or a normal bacterial situation that people have. So one of the things that we've done is we have a caries screening test or a decay screening test that we do, and we swab your mouth with a cotton swab and place it in a material called luciferin, and that is what you find inside a lightning bug's butt. And so when the bacteria are placed in the luciferin emits energy, and that energy causes the luciferin to transmit light. We put that in a meter, and that meter will tell us whether you have a lot of bugs in your mouth or a few bugs in your mouth. If you have a lot of bugs in your mouth, they may be bad bugs that cause you to have decay issues. So what are we going to do with those? Well, we want to lower the number of bugs in your mouth. And in the past, what we used to do was tell people you need to brush better, get some Listerine, do those kinds of things. But now what we want to do is we want to shock your mouth and really kill the bad bugs on top of giving you fluoride that will make your teeth stronger. So this book is something that we give to our patients that have decay issues when they come in. It's their book to keep. They get to read over the book and they self-diagnose why they're having problems. If the person has a problem with decay due to dry mouth, we need to make sure that they don't have dry mouth. If they have decay issues because they don't take better care of their teeth, enough care of their teeth, then we're going to work on hygiene, things like that. dietary monitoring, if a person's drinking soft drinks all the time. If a person has reflux disorder, in other words, they have contents from their stomach coming up on their teeth, we may want to send them to their physician and get them on a medication so that they don't have a problem that way. But ultimately, the old idea that we were just going to do a fluoride application every time the patient comes in every 6 months, that's not working for us anymore. So we have products available for our patients, fluoride rinses that people use on a daily basis that are on a prescription level that give them a better chance of keeping their teeth for a long lifetime. And so that's our ultimate goal. Keep your teeth for a lifetime. Determine why it is that you're having decay. And those are the things, if you come into our office, we can go over with you, give you an assessment. It might be your child that has decay issues. It may be you that have decay issues. It may be your mom or dad that have decay issues, that you're not finding the answers to the problems that you're having. Everything is continuing to go south. So we can probably help you with that. We just have to talk to you, talk with your relatives, and determine why it is that you're having the issues that you're having. Feel free to go to our website. We have information about our decay issues on our website. And if you come into our office and you have decay issues, we can certainly give you this book that you're welcome to keep and go over.